My name is Lola, Dr. Lola Mola. I'm a pediatric emergency and critical care doctor. That means I take care of children who are in the emergency departments and the high dependency unit and the pediatric emergency and critical care units. It is true that children indeed do get diabetes. Many a times when we interact with mothers and interact with caregivers and even interact with other people in the community, and you bring forth a conversation about diabetes, the thought is usually that this is a disease that affects the older population or the older people, but that is not a true state of activity. So what usually happens is that children indeed do get diabetes. The diabetes that you get in pediatric population is type 1 diabetes. And so what happens in type 1 diabetes is the fact that you do not have the insulin. So the insulin is the hormone that is required to regulate your sugars in the body. And that is different from what we get in the older or the adult population, where insulin is not the big problem. They probably have the cells that produce the insulin, but they are resistant to the insulin that is being produced. So that makes the difference between type 1 and type 2 diabetes. Common questions that you normally get is that what caused the diabetes? One is the genetic part of it. So we have a genetic component where it is highly likely that if diabetes run in the family, then this child is highly likely to get the diabetes. But this is more common with type 2 diabetes as compared to type 1 diabetes. How then are you going to be able to identify, or when do you start suspecting that your child has diabetes? So the presentations are usually non-specific in nature. And so it takes a lot of keen eye, both from the parents and also the caregivers or the doctors, to be able to decipher and identify or even suspect diabetes to be the problem for those specific children. One is a child had stopped wetting the bed, what you call enuresis. So this is a child who had stopped wetting the bed. Then all of a sudden, as the child is growing older, instead of getting good bed control, now they're starting to pee a lot. It's because there's a lot of frequency with the urination. The other common presentation is just increased food intake. So I know we have growth spurts and children have, like right now it's holidays and every child in the household is basically eating everything that is available. You go to work, you come back, even the bread that you left is not there in the morning, and so you assume that it's just a growth spurt. But they tend to disproportionately eat. Like a child will probably is eating breakfast, then 10 o'clock, then 4 o'clock, and the meals, the numbers are actually increasing, and increasing even in the quantity. So there's the what you call the polyphagia, where they want to eat a lot, and this is enough for them to wake up at night to even go and take not only the midnight snack, but they're now literally eating even at night. And with that, cumulatively, they also end up with drinking a lot of water. Now, children don't like drinking water, so they tend to prefer drinking the juices and the sodas. And so if you see a child who's eager to drink a lot of water, it's because of that dehydration. The sugar is a lot in the body, and so they're trying to dilute this sugar, and by doing so the body is is activating the thirst center, which is telling them to go and drink lots of water. So you will notice easily that they present with a lot of drinking of a lot of fluids. But many a times these children present as an emergency, because this sugar has not been followed up for some time. It's many a times their first presentation, so they come up with an emergency where the sugar is non-recordably or is very, very, very high. And so they come very critical. They have difficulty in breathing. Probably they even they're in a coma or altered level of consciousness, and it's until you are able to take a clear history and do the test, that's when you diagnose that the baby has diabetes. So once you've suspected that a child or the patient has diabetes, there are tests that can be done immediately. And the good thing about these tests are, one, they're available in the clinics, they're available in the pharmacies, they are available in any health center. You are able to do what you call a random blood sugar. So this is usually it's almost a painless procedure, because you just need one needle prick, and then you get a small sample, a drop of it, and that is able to give us the sugar level. The next thing that you're going to do is that you're going to take a urine sample. And again, for pediatric population, we get concerned about the pain scale, and is the procedure going to be painful, and how will the child react to it. One of the good things about urine sample is all the child needs to do is to pee in a container or even in a potty, and we're able to get it. Urine dipstick is also, again, another accessible one, easily available. Of course, it has its drawbacks, but it's one of the easiest screening methods that can be used for diagnosis and also for the follow-up for the children when we are managing them in the ward. So there are things that we don't expect your kidneys to be allowing them to go outside. So when we check your urine and we are able to see glucose, for example, it means the amount of glucose the baby has in the body is a lot. That is why most of it is seeping out. And so when you see glucose in your urine, when you start seeing other things like ketones in your urine, it's a sign of dehydration. So it is a simple test, but can be able to communicate a lot to the caregiver and, more importantly, to the healthcare worker, and that informs the decision that you're going to make even as we diagnose the patient and then monitor the patient. Question we normally get: if the children can live a normal life with diabetes. Yes, it is true that children can just live a normal life with diabetes. We encourage them that one is that they be part of the extracurricular activities so that they're able to exercise a lot, they're able to run, they're able to play around with other children, because this helps them get good control of their sugars. For type 1 diabetes, the only drug that works is insulin. There is no two way about it. And so one of the things we normally do is we train the child, it's age dependent. For smaller children, we train the caregivers, the nannies and the parents on how to give the insulin. For older children, we train them on how to give the insulin themselves. Right now, we have beautiful small pens that are very available, so you don't have to keep pricking and giving injections. They just have to nip it a little bit in the stomach or on the thighs, and it delivers the amount of insulin they are able to give. So to the caregivers, we normally give them a book, and in the book there are things that we expect them to record, because this is what we will use when the children come for the visit to find out how well the sugar is controlled. So every day when they wake up in the morning, they're supposed to be taking a sugar level. Before every meal, they give us a sugar level. So this tells us the trend and how well the sugar was being controlled, so that when the levels spike up or when they are fluctuating, then we make interventions and we're able to intervene and correct either the low sugars, meaning that the insulin level is very high, or the high sugars, which means that we've not given the right amount of insulin. So the graph is usually very, very important. But also, we encourage them on the diet. Remember, diet plays an integral role in the control for diabetes. So these children, we put them on balanced diets, so they're always taking the normal proteins, carbohydrates, and they take the fats. In the spirit of diabetes and even controlling our obesity for children, when we walk home, let's carry a bag of apples, let's carry our grapes, let's carry our bananas, let's carry our yogurts, and let's carry our juices, so that this is what we are availing to the child. There's a lot of hope for the children who have diabetes. It is not a life sentence. Once the diagnosis is made, embrace the diagnosis, walk the journey with the child. And to all of us who are parents, let's be on our feet and let's walk and walk and walk and walk, because the only way to fight diabetes is to walk the diabetes.